Uh, Just, we will have the opportunity for a second round of questions, and obviously an opportunity to submit questions for the record. Senator Reid, it is now your turn.
Thank you very much, Madam Chairman. Secretary Becerra, great to see you. I had the privilege of serving with you in the House, and you're doing a superb job as the Secretary, so thank you. We spoke on the phone a few weeks ago about the growing importance of research into RNA. That was the real driving force between the COVID vaccine. And as I indicated on the phone, Brown University in Rhode Island is establishing itself as one of the leaders in RNA research. They're putting up an extraordinary amount of money for facilities, et cetera. At the same time, ARPA-H is quickly standing up and also hopefully making the RNA project one of their first and most important objectives. So could you give me a sort of a readout of where we are, and also going forward, keep me posted? And also, as I said, I think Brown is really the place where academia and your ARPA-H can meet.
Senator, I communicated the information we discussed to the folks at ARPA-H. Dr. Wegerson, the director, she just recently, for example, announced that one of the 3 sites for ARPA-H will be based here in the DMV. And what we know is that she's going to use a hub and spoke model, as she's mentioned, where it's not going to be a heavy footprint in any one particular place, because what they're looking for is all these creative ideas that sometimes are generated by the smallest of business, but they have a great idea. They just don't have the capital. And so from what I can tell you, they are beginning to receive solicitations for grants. They have hired some of the program managers who will be in charge of the projects. And we can make sure that the folks at Brown are in touch with the correct program managers within ARPA-H to make sure that their proposal is considered.
Thank you very much, Mr. Secretary. Let me turn quickly to an issue that is extremely troubling, and that's suicides in the United States, particularly with young people. It is a public health crisis. Recently, with the cooperation of many people on this panel, we were able to get through the 988 number, which is a simplified way to seek out counseling support just to speak to someone else. Can you talk about the President's budget request for the 988 and all the associated support, and how that funding could be used to increase awareness to young people especially? And also, I might add, young people, I have a 16-year-old, they don't use telephones the way we used to do. They don't dial. Yes. I don't know what they do, but text is the thing. So are we going to get into the text world too?
Yes. Senator, I still don't understand it, how someone, especially someone who's going through a real crisis, thinks it's easier and better to text than to actually speak to a live person. But and it's working. And I got to tell you, we have seen a dramatic increase in the number of texts that we've received. By the way, I need to say thank you to you and your colleagues, because it was the federal government's resources that helped stand up the text and chat functions within 988. The states, and we keep asking the states to come forward, because there are some states that have actually created a permanent stream of funding for their 988 operations. Remember, 988 is not a national suicide prevention lifeline. It is a nationwide system that brings together the states. And we, because of the resources you gave us, were able to glue it together. But it still requires resources. And we are doing the text and chat function. We help stand up and expand a Spanish language function, so those who are limited in English can communicate as well. We're doing something that's specialized for LGBTQI+ communities as well. There is a line that's been stood up in the state of Washington for Native American community members. And so we're finding that everyone's trying to figure out how they can really reach folks. And the President's budget continues his dramatic commitment to 988 by putting in several $100 million to make it work, because people are calling. And it's kind of sad that people are calling, because that means people are hurting, but at least they're calling.
Thank you very much. Just a final point. I think you also reached out to the veterans community.
Yes, we did.
With specialized lines. So I commend you on your implementation. Many times we do things and they don't really get implemented. You've done a superb job.
Thank you
Thank
very
you,
much.
Mr. Secretary. Thank you, Madam